I am Dr. Laura Marino, and in this video, I want to talk to you about heart attacks and the warning signs the body can give before or during one, signs that many people confuse, minimize, or completely ignore. A heart attack is often imagined as something sudden and dramatic, but in reality, the body frequently sends signals that are subtle, confusing, and easy to dismiss. Understanding these signals can make a critical difference. One of the biggest problems with heart attacks is not lack of information, but misinterpretation. People often expect intense chest pain as the main symptom. When that doesn't happen, they assume nothing serious is going on. But the body doesn't always follow the textbook version, and that's where danger lies. One common warning sign is chest discomfort that doesn't feel like sharp pain. It can feel like pressure, tightness, squeezing, fullness, or a heavy sensation in the center or left side of the chest. Many people describe it as something not right rather than painful. Because it can come and go, people often ignore it or blame stress, indigestion, or muscle strain. Another frequently confused symptom is discomfort that spreads beyond the chest. Pain or strange sensations can travel to the left arm, right arm, shoulders, neck, jaw, or upper back. This discomfort may feel dull, aching, or like pressure. Because it doesn't stay in one place, people may think it's a nerve issue or poor posture. Shortness of breath is another key warning sign. This can appear suddenly or gradually, and it doesn't always come with chest pain. You may feel like you can't get a full breath, even at rest or with minimal activity. Many people attribute this to anxiety, being out of shape, or respiratory issues delaying action. Nausea, stomach discomfort, or a feeling similar to indigestion is another symptom that is often misinterpreted. Some people feel bloated, nauseous, or experience a burning sensation in the upper abdomen. Because these sensations resemble digestive problems, people may take antacids or wait it out, losing valuable time. Unusual fatigue is another signal that is commonly overlooked. This is not normal tiredness. It's a deep, sudden exhaustion that feels out of proportion to your activity. Some people feel drained even after light tasks or feel an overwhelming need to sit or lie down. This can happen days or even weeks before a heart attack in some cases. Cold sweats or sudden sweating without an obvious reason can also be a warning sign. The sweat may feel clammy or heavy and may be accompanied by a sense of unease. Because sweating can occur with anxiety or heat, it's often dismissed. Lightheadedness or dizziness is another symptom that can appear. Some people feel faint, unsteady, or like they might pass out. This can happen because the heart is not pumping efficiently, affecting blood flow to the brain. One of the reasons these symptoms are so dangerous is that they don't always appear all at once. You might experience one or two of them, mildly, and decide to wait. The body's warnings are often subtle, and the mind looks for benign explanations. Another important point is that heart attack symptoms can differ between individuals. Age, sex, and overall health influence how symptoms appear. Many people, especially women, experience less typical symptoms and more generalized discomfort, fatigue, or nausea rather than intense chest pain. People with diabetes may experience blunted pain signals due to nerve changes. This can make heart attacks harder to recognize, increasing the risk of delayed treatment. Stress and anxiety can mimic some heart attack symptoms, which adds to confusion. Chest tightness, shortness of breath, and sweating can occur with panic attacks. But assuming it's just anxiety without evaluation can be dangerous, especially if symptoms are new, intense, or different from what you felt before. The timing and pattern of symptoms matter. Symptoms that worsen with activity and improve with rest are more concerning than those that are random. Symptoms that wake you from sleep or appear suddenly without a clear trigger also deserve immediate attention. Another warning sign people often ignore is a general feeling of impending doom or something being very wrong. This sensation is hard to describe, but many people who experience heart attacks report feeling that something serious is happening, even if they can't pinpoint why. The body often gives warnings because the heart is under stress. Reduced blood flow, inflammation, or plaque instability can all trigger these signals before a complete blockage occurs. Ignoring these signs doesn't make them go away. It just allows damage to progress. It's also important to understand that heart attacks are not always caused by extreme exertion. They can happen at rest, during sleep, or during routine activities. Waiting for a perfect scenario to match expectations delays action. Recognizing warning signs early allows for faster treatment, and faster treatment saves heart muscle and lives. The goal of understanding these symptoms is not to create fear, but to build awareness. The body communicates through sensation, and learning to listen without panic but with respect can change outcomes. And as you continue listening to how your body signals stress, discomfort, and imbalance, you may begin to notice patterns that help you distinguish between ordinary sensations and signals that deserve immediate attention, opening the door to acting sooner rather than later when something truly matters. And that ability to notice patterns is essential because one of the most dangerous aspects of heart attack warning signs is how easily they blend into everyday discomforts. Many people live with stress, digestive issues, muscle tension, or fatigue on a regular basis. When heart-related symptoms appear, they often hide behind these familiar sensations, making it harder to recognize that something different is happening. Another symptom that is frequently confused is pain or discomfort in the upper back, especially between the shoulder blades. This can feel like a deep ache, pressure, or burning sensation. Because back pain is so common, especially in people who sit a lot or carry tension, it's often attributed to posture or muscle strain. But when this discomfort appears suddenly, without a clear mechanical cause or alongside other symptoms, it deserves immediate attention. Jaw pain is another classic example. Some people experience tightness, aching, or pain in the jaw or throat area. This is often mistaken for dental problems, sinus issues, or tension. Because it doesn't involve the chest directly, it's easy to dismiss. However, the heart and jaw share nerve pathways, which is why heart-related pain can be felt there. Arm discomfort doesn't always mean sharp pain either. It can feel like heaviness, weakness, numbness, or a strange sensation in one or both arms. People often think they slept wrong or strained a muscle, especially if they've been active earlier in the day. Another confusing sign is sudden anxiety or restlessness that appears out of nowhere. Some people feel intensely uneasy, agitated, or unable to relax without knowing why. This is sometimes described as a sense of doom or danger. While anxiety can certainly cause physical symptoms, sudden anxiety combined with physical discomfort should not be ignored. Heart attack symptoms can also come in waves. You might feel discomfort, then feel better for a short time, and then feel worse again. This on and off pattern can falsely reassure people and lead them to delay seeking help. Intermittent symptoms are still symptoms. Another important point is that not all heart attacks start with severe pain. Some begin with mild discomfort that gradually intensifies over hours. Waiting for pain to become unbearable is a common and dangerous mistake. People who are physically active sometimes assume they are protected and dismiss symptoms because they exercise regularly. While physical activity is protective, it does not eliminate risk completely, especially in the presence of other factors like family history, high blood pressure, cholesterol issues, or smoking. There is also a tendency to downplay symptoms out of concern for bothering others or overreacting. People worry about going to the emergency room and being told it's nothing. But when it comes to heart symptoms, it's always better to be evaluated and reassured than to stay home and risk serious damage. Time is one of the most critical factors in a heart attack. The longer the heart muscle is deprived of oxygen, the more damage occurs. Early treatment can restore blood flow and significantly reduce long-term complications. Another reason people delay is because symptoms don't match what they've seen in movies or heard described dramatically. Real-life heart attacks are often quieter, more confusing, and more subtle than expected. Risk factors also influence how symptoms appear. People with diabetes, for example, may have reduced pain perception and experience fewer classic symptoms. Older adults may present with confusion, weakness, or shortness of breath rather than pain. Women often report more nausea, fatigue, and discomfort rather than intense chest pain. Understanding these differences is critical because expecting one specific symptom can blind you to others. It's also important to mention that heart-related symptoms are not always triggered by exertion. They can appear at rest, during sleep, or during emotional stress. The absence of physical activity does not rule out a heart problem. Another warning sign that is often ignored is a sudden drop in exercise tolerance. If you find that you become unusually tired or short of breath doing activities that were previously easy, that change matters. Some people notice swelling in the legs or ankles before or after heart-related events. While swelling has many causes, it can reflect changes in heart function and circulation. The body is remarkably good at signaling distress, but it doesn't always use pain as its main language. It uses changes, patterns, and sensations that feel off. Learning to trust that sense that something isn't right, even when you can't explain it clearly, is important. Many people who survive heart attacks report that they felt something was wrong but talked themselves out of acting. Ignoring intuition in the face of physical symptoms can be dangerous. The goal is not panic but respect for what your body is communicating. Recognizing heart attack warning signs early doesn't mean assuming the worst. It means taking symptoms seriously enough to get help quickly. And as you become more familiar with how the body communicates cardiac stress, you may find it easier to distinguish between everyday discomfort and signals that require immediate attention, giving you the confidence to act decisively when timing truly matters and allowing you to respond to your body with awareness rather than hesitation. And that confidence to act is something many people struggle with, especially when symptoms are vague or don't match expectations. We are taught to doubt our bodies, to minimize discomfort, to push through. That mindset is particularly dangerous when it comes to heart-related symptoms, because delay is one of the biggest risk factors for worse outcomes. Another warning sign that is often misunderstood is sudden weakness, or a feeling of heaviness in the body. This is not the same as muscle fatigue from exercise. It can feel like your arms or legs don't have their usual strength, or like your body is suddenly harder to move. People sometimes sit down and wait for it to pass, assuming they are just tired. Some people also experience sudden paleness or a grayish tone to the skin, sometimes noticed by others before the person feels seriously unwell. Changes in skin color can reflect changes in blood flow and oxygen delivery. A rapid or irregular heartbeat can also be a warning sign. You may feel palpitations, fluttering, or a sensation that your heart is racing or skipping beats. While palpitations can have many causes, when they appear suddenly along with other symptoms like chest discomfort, dizziness, or shortness of breath, they should not be ignored. Another confusing symptom is pain that seems to come from the stomach or upper abdomen and radiates upward. This can feel like severe indigestion, pressure, or cramping. People often try to treat it with food, antacids, or rest. When it doesn't improve or is accompanied by other signs, it may be cardiac rather than digestive. Heart attack symptoms can also change with position. Some people feel worse when lying down and slightly better when sitting up. Others feel no relief in any position. Paying attention to what makes symptoms better or worse can provide important clues. There is also the issue of denial. Even when symptoms are concerning, people often tell themselves they are too young, too healthy, or too busy for something serious to be happening. Heart attacks do not check schedules or assumptions. Another factor that delays action is fear. Fear of hospitals, fear of bad news, fear of being wrong. But fear should never override safety. Medical professionals would much rather evaluate someone and find nothing serious than see someone arrive too late. It's important to understand that calling for help early is not an overreaction. It is a protective action. Modern treatments for heart attacks are most effective when given quickly. Minutes matter. Some people hesitate because symptoms improve temporarily. This improvement can be misleading. Blood flow can fluctuate and symptoms can ease before worsening again. Temporary relief does not mean the danger has passed. There are also warning signs that appear days or weeks before a heart attack. Increasing fatigue, reduced exercise tolerance, mild chest discomfort with exertion, or shortness of breath that slowly worsens over time can all precede an acute event. These early warnings are often ignored because they don't feel urgent. Listening to early signals allows for evaluation and intervention before an emergency occurs. Preventive care saves lives. Another important point is that heart attacks can look different depending on the type of blockage and the area of the heart involved. This is why no single symptom defines a heart attack. Education helps, but awareness must be paired with action. Knowing symptoms is only useful if you are willing to respond when they appear. The body does not use dramatic language. It uses changes, discomforts, and patterns. Respecting those signals, even when they are confusing, can change outcomes. Heart attack awareness is not about living in fear. It's about understanding that your body is on your side. It gives warnings because it wants help. And as you continue learning to recognize these warning signs and trust your instincts, you empower yourself to respond quickly, seek help without hesitation, and prioritize your health in moments when acting sooner rather than later can make a profound difference, not only in survival, but in long-term heart function and quality of life. And that prioritization of health sometimes requires unlearning habits we've carried for years. Many people are used to pushing through discomfort, especially if they have responsibilities, work, or family obligations. They tell themselves they'll rest later, that it's probably nothing, that they can't stop right now. But the heart doesn't respond to schedules or excuses. When it sends warning signs, it's asking for immediate attention. Another reason heart attack symptoms are missed is because they don't always cause pain in the way people expect. Pain is sharp, clear, and demanding. Heart-related discomfort is often dull, pressure-like, or simply strange. That strange feeling is often what people struggle to interpret. It doesn't fit neatly into a category, so it gets ignored. Some people describe feeling suddenly unwell without being able to explain why. A sense of weakness, unease, or internal alarm that feels different from anxiety. This internal warning is important. It doesn't come from fear, it comes from physiological stress. Trusting that signal can be life-saving. Another confusing symptom is sweating that appears out of proportion to activity or temperature. You may break out in a cold, clammy sweat while sitting or resting. This kind of sweating is often dismissed as nerves or stress, but when it appears suddenly with other symptoms, it should raise concern. There are also people who experience a sudden need to rest. They feel compelled to sit or lie down because their body feels overwhelmed. This is not laziness or weakness. It's the body conserving energy when the heart is under strain. Heart attack symptoms can also be quieter in people who live with chronic illness. When discomfort is already part of daily life, new symptoms blend in more easily. This makes awareness of changes even more important. A change in pattern matters more than any single sensation. Another subtle warning is nausea without a clear cause, especially when it appears with sweating, fatigue, or chest discomfort. People often assume it's something they ate. But when nausea appears suddenly and doesn't fit the context, it deserves attention. Some people feel a pressure or discomfort in the throat, like something is stuck or tight. This is often mistaken for reflux or anxiety. Again, shared nerve pathways can cause heart-related discomfort to appear far from the chest. It's also important to talk about timing. Symptoms that appear suddenly, wake you from sleep, or come on during minimal activity are more concerning than those that build slowly during exertion. Nighttime symptoms are especially important because the body is at rest and should not be under stress. Another common delay happens when people try to wait it out to see if symptoms go away. Waiting is one of the most dangerous responses. If symptoms are heart-related, time lost cannot be recovered. Emergency care is designed to evaluate symptoms quickly. Tests exist to determine whether the heart is under stress or damaged. Getting checked does not mean you are weak or dramatic. It means you are taking your health seriously. It's also worth mentioning that calling emergency services rather than driving yourself can be safer. If symptoms worsen suddenly, having trained help immediately available can make a critical difference. Many heart attack survivors later say the same thing. They knew something was wrong, but they hesitated. Education helps reduce that hesitation. Recognizing symptoms is not about memorizing a list. It's about noticing when your body is behaving differently than usual, when discomfort doesn't match the situation, when rest doesn't bring relief. The heart is resilient, but it has limits. When those limits are approached, the body sends signals. Those signals are not meant to scare you, they are meant to prompt action. Listening early allows treatment to begin before extensive damage occurs. It preserves heart function, reduces complications, and improves recovery. And as you continue to reflect on how the body communicates cardiac stress, you may find yourself more attuned to changes, more willing to pause and respond, and more prepared to act decisively when sensations don't add up, continuing to build awareness that can protect not only your own life, but also help you recognize warning signs in others when moments truly matter. Subscribe to the channel and turn on the notification bell so you don't miss future videos where we talk about health in a clear, calm, and responsible way. Share this video with someone you care about because this information can save lives. Leave your questions or experiences in the comments and join me as we continue learning how to recognize the body's warning signs and act in time when it truly matters.